I am the co-founder. I am the co-founder of Sepalika, and with due permission from all of you, we will record this session, because what we're doing is that we are sharing this video after this on YouTube so that others can see it. This is a part of Sepalika's monthly webinar. It's a knowledge webinar that we do every month. Mahesh and I set up Sepalika with the real objective is to actually empower more women to take charge of their health. I know we have a lot of gentlemen on this particular webinar, and I'm really glad, but our goal is to actually spread the knowledge. So we put it out on our YouTube channel called Sepalika, and please subscribe to our Instagram channel called Sepalika Fertility. Each week we put out at least 3 to 4 videos, and everything is about women's and reproductive health, and it's about pregnancy and conception. It's a lovely Sunday morning here in Mumbai. We're seeing the sun after almost 2 weeks. For those of you who are here, do enjoy the day. I'm going to do a quick introduction to the topic, and then I will hand over the mic to Mahesh. This is actually, September is PCOD Awareness Month all over the world. And PCOD, being a hormone-related condition, has a huge connection with fertility or conception. Interestingly, the first Sepalika baby we had was a lady who came to us with a history of PCOD. And we worked on the PCOD, we balanced our hormones, and it led to natural conception, pregnancy, and her child is probably almost 3 years old today. You know, a lot of women who speak to me say that their doctor has been putting them on birth control pills to regularize the period. And usually they're asked, once the periods are regularized, then they tell them they will stop the pill and you can try. But is this the real solution to PCOD? Will this have any risk for future pregnancy? That is what I'm going to invite Mahesh Jayaraman, my co-founder and Sepalika's chief medical and fertility expert, to tell us what is the connection between PCOD and fertility. Mahesh, what are the solutions that conventional medicine or gynacs offer today? What are the potential downsides? And how can women or couples or women who come with a PCOD history, how can they address it so that it can lead to natural conception? Over to you, Mahesh. You have to unmute yourself.
All right. Okay. Thank you so much, Sharda, for that. And thank you, everybody, for joining in on a Sunday morning. Like Sharda said, this is part of our attempts at outreach, at education, at helping people understand their own health and therefore take charge of what's happening with them. Polycystic ovarian syndrome, PCOS, is a very, very common condition. It's literally said to be between 1 in 5 to 1 in 4 as far as India is concerned. And among women specifically who are facing fertility issues, the number of people in whom PCOS may be the primary reason for their infertility, that number is as high as 1 in 3. That means every third lady who's got fertility issues has some kind of a polycystic ovarian syndrome. So the important thing is the syndrome, not the disease. And therefore, you can have certain features of PCOS, still not have full-blown PCOD, and yet your fertility may be impacted. So before we get too far, and I'm going to try and keep this introductory part quite short so that we can take everybody's questions. The first thing to understand is, what is polycystic ovarian syndrome, PCOS? As the name suggests, early on when it was discovered first in medical science, they found that inside the ovaries of women, there were little follicles that were sitting on the outer periphery of the ovary where they are not meant to be. And they were sitting in the shape of a pearl necklace. And so this particular feature became the #1 identifying feature of polycystic ovarian syndrome, PCOS. But however, with progress and with medical science advancing, we now know that a woman who has polycystic or multiple small follicles on ultrasound, when you do the ultrasound test, may not have PCOS. And conversely, you may not have this pearl's appearance in ultrasound and still have features of PCOS. So from a layperson's point of view, what are the main features of PCOS? #1, periods will often be in longer gaps and maybe irregular as well. So what does that mean? So let's say that most women think that you should get periods in 28 to 30 days. Women with polycystic ovarian syndrome may get it only once in 45 or 50 days. That is number one. Number two, women with polycystic ovarian syndrome will often have anovulatory periods. And what that means is, while you may get period cycles regularly, even if they are delayed, so every 45 days you get a period, but in those 45-day periods, you may still not have an egg that is released during that period. And what does this mean? From a practical standpoint, it simply means that if an egg is not released, you cannot fall pregnant. Going on further, polycystic ovarian syndrome, women with this condition will have excess male fecals. So this includes, like I said, the lack of ovulation, but it also includes other things like higher amount of facial or body hair, as well as, in some people, there can be a throat issue, etc. that happens. May I just ask, I think some people are still unmuted and there is a lot of ambient noise coming in. If I may request everybody to just mute themselves so everybody can hear clearly. Yeah, all right. So polycystic ovarian syndrome, the one other thing which I want to put into this introduction, and then we'll take the questions. Many women ask, is it genetic? Will it ever be cured? And the answer is yes. The tendency to have polycystic ovarian syndrome type of symptoms, delayed periods, cystic acne, facial hair, anovulatory periods, trouble with fertility, weight gain, all of these features do seem to have a genetic component. However, it is lifestyle that seems to trigger it. This is why many women start getting PCOS only around the time they either reach teenage, when there's a lot of junk food that enters into the system, or when they have finished college, or they go to hostel, or they stay in a PG where the food habits change. So while genes do load the gun in PCOS, it is your lifestyle that pulls the trigger. And therefore, the good news for everybody listening is that polycystic ovarian syndrome is indeed something that can be managed. You can reverse the condition and get back your fertility by correcting your lifestyle. I think with that introduction, Sharda, we can move forward and look at other aspects, including fertility and what questions people have.
Thank you, Mahesh. My request is, if you have a question, you have two options. You can type into the chat box. If you want to maintain confidentiality, you can send it directly to me, and I will raise this question with Mahesh. And if you want to raise your hand and ask a question, please do so. You could unmute yourself and ask. Mahesh, I have my first question here already, which says that I have PCOD, and my periods are not so regular. They vary between 35 to 42 days. What she's asking is, will this be a problem for me to have a child?
Yeah, very valid question. So as long as the periods are coming in a reasonably regular gap between 35 to 40 days, it's very likely that your periods are ovulatory. It means in the middle of a period cycle, whatever be the period cycle. So let's assume that a woman has a 30-day period cycle. Around day 14 or 15 of that, an egg is released from the ovary, and that is the crucial event that has to happen for you to be able to get pregnant. In a woman with PCOS, it doesn't happen in the middle of that 45-day period. So all that happens is you can take away 2 weeks from the other end, which means at the 45-day mark, take away around 14 days. And that means that you will likely be somebody who ovulates around day 20 or 21. So when it comes to trying for natural fertility with PCOS in a 45-day cycle, when you reduce 14 days from that, around day 20 or 21 is when you will be releasing an egg. So trying for natural conception around day 20 or 21 is what you need to do. This is just not knowing any further details, but just knowing that your periods are regular between 30 and 45 days. There could be other parts of the reproductive system that need to be addressed, but this is the general answer.
Got it. What are the symptoms of PCOS apart from irregular periods?
I think we covered that, but I'm going to quickly list it off for anybody who's joining late as well. Number one, like we said, so long period gaps is number one. Number two is facial hair or body hair that is excessive in ladies. Number three is acne, cystic acne, especially painful acne breakouts that happen, mood swings, which can be pretty severe. This is not limited only to PCOS, but many women with PCOS do undergo this sort of thing as well. Weight that is stubborn, that doesn't go away despite dieting, despite exercise. And this is because insulin resistance is a key feature of almost 70 women.
Sorry, I think Mahesh, we seem to be having a connection issue with Mahesh. Mahesh, yeah, are you back?
Yes, I think I am.
We lost you when you said, when you were talking about insulin resistance.
All right. Okay. So yeah, I'll just complete that. Nearly 70 to 80% of women with PCOS will also have insulin resistance. And that is what explains the stubborn weight gain and inability to lose weight. Sharda, while you're on the next question, I'll quickly switch networks.
Oh, all right. Please do that.
So please go ahead.
Yeah. Okay. So the next question is that I am having PCOD. I'm really suffering to get pregnant. Would you have any solution for this? So yes, we do. While Mahesh comes on, Mahesh, you tell me when you're back on.
I'm back on, yes.
All right, go ahead, Mahesh. Solution for somebody who has PCOD and is trying to get pregnant.
Okay, so the answer is twofold. Number one, like I said, in PCOS, there is a very large lifestyle component. So reducing the amount of processed carbs that you eat, which means, a lot of people think that eating at home is equal to eating healthy. These two are not the same thing. Eating at home means one aspect of outside food, which is usually the terrible oil that they cook in. That at least is taken care of, no doubt. But if you have a plate which has nothing but grain carbs as half to three-fourths of it, which is most of India, whether it's the roti or the rice or the dosa or the idli, it kind of is the hero of that plate. The whatever we have with it, the sabzi, the chutney, the vegetables, etc., become a small portion of it. So it is important to change this ratio and reduce the amount of processed grain carbs that you eat. That is number one, lifestyle. Number two, stress management. If you're somebody who's under a lot of stress and you are always in a fight or flight situation, you've got very high demands on your time, etc., your body will recognize this and not let you have a baby, because it knows that a fight or flight time is probably not a good time to have a child. So these are two big things that I would say for somebody with PCOS. But I do want to make a distinction. Why does Sepalika run two programs? We run a PCOS program and we run a fertility program. So what is the difference? Why can't somebody with PCOS who's wanting to have a child just join the PCOS program, which is for 3 months? And instead, why should they prefer to join the fertility program? The answer is pretty simple. PCOS is a condition where there is an ovulatory issues and there are many non-fertility symptoms like acne, body hair, weight gain, etc., which may not be relevant to fertility. So the PCOS program helps to address those specific issues. But when a lady wants to conceive with PCOS, we often say that if you come on the fertility program, not only do we address the PCOS related symptoms, but there are other things of fertility that may need addressing. For example, women may have fallopian tube blockages. If you have that, then you cannot conceive despite whatever else you do. You may have uterine fibroids or polyps, or your endometrial thickness may not be growing to the appropriate thickness needed for conception, for implantation of the embryo. These are very specific non-PCOS fertility factors which also need to be addressed. So there are two parts to this. Begin with the low-hanging fruit, address your diet and your lifestyle, get your periods into more regularity. But if fertility is your main goal, there may be more than PCOS that's at play.
Yeah, great distinction, Mahesh. Thank you for pointing that out. The next question is, and this is a very interesting one, how do I know whether the egg is being released or not? And this is fantastic, given that women have irregular periods, hard to predict when ovulation is happening.
Yeah, absolutely. So, two ways of looking at this. There are enough and more Google home, hacks that you get, right? So from both the ones at the more sciencey end to the ones that are very, sort of may happen, may not happen, but over tradition, we have known this. So let's start with the very, very basic common sense, common man, and go all the way up to where science and technology is able to help us to tell whether you're ovulating or not. So number one, women will often complain, some women, and this is why this is not 100% reliable. Some women will complain of a pain in the middle abdomen area. It's called Mittelschmerz, and it is a German word for a pain, literally means middle pain. And that middle pain is supposed to happen when an egg is released from an ovary. So some people believe that that could be a sign that you have ovulated. Unfortunately, however, not all women face this pain, and not all women can reliably tell if they have ovulated. So this is number one, very home, rough and ready technique of telling whether you have ovulated. Second, a little more reliable is a home ovulation kit. So you get ovulation strips where there is a litmus paper that comes as part of a kit that you buy. You get the morning urine, little bit of it you collect in a container, or you can also put the urine directly on the strip. You kind of let it dry a little, and once the color changes, or in some devices which are digital, you put it into the meter. It tells you whether you are going to ovulate shortly. Now, this is a predictive method, and unfortunately, the chemical that is being measured in the urine is something called luteinizing hormone, or LH. And LH is a hormone that is secreted from the brain in order to provoke ovulation. However, there could be times, especially in women with PCOS, where their ovaries don't listen to the LH very well. So you could get a false positive that the LH is high and therefore ovulation is going to happen, or it's imminent, but only the LH surges, ovulation does not happen. So especially in women with PCOS, where their baseline level of LH itself is higher because of certain genetic traits that they have, ovulation kits are a notoriously difficult, not really reliable to predict ovulation. Getting on to the easiest way that Sepalika prefers in order to test whether you've ovulated. Unfortunately, this can be done only after ovulation. So if you're trying to conceive, you have to have intercourse before ovulation. So maybe the testing for ovulation can be done one period before the one where you want to try. And then in the next period, you can again try. So how this works is that at the point when you ovulate, there is an egg that is released from your ovary, and the outer covering of that egg begins secreting a hormone called progesterone. And progesterone is an easy blood test to do in India. It doesn't require a doctor's prescription. So if you take a blood test 7 days before your expected onset of the period, and if your progesterone value is above 8, then you can be reasonably sure that you have ovulated. Why is that value of 8 important? Because from the time when your ovulation happens, progesterone levels begin to rise, and they peak around 1 week before your expected next period date. So if you test serum progesterone, and it's not an expensive test, anywhere between 250 to 500, 600 rupees in India, depending on what city you live in, you can get a serum progesterone test done, and that is a sure way to tell ovulation. Of course, the final way, which involves a gynecologist, is to do a follicular study. This is a transvaginal ultrasound where you can actually see the egg being released from the ovary. The gynac calls you for multiple visits, usually 4 or 5 on different days of the period until ovulation day. And that is a sure way to tell whether you're ovulating or not.
There is a related question, Mahesh, on this, which is this lady is inducing ovulation for the last 5 months. But she says everything is fine, and yet the egg is not rupturing. What could be the reason?
Yeah. So this is called, luteinized unruptured follicle syndrome, and it is a difficult one to treat. So again, this is up to your gynecologist. And for the benefit of everybody else listening, let's try to understand what the question is. So there seems to be an egg that is maturing as seen in follicular studies. In the natural course of events, when you don't have a gynecologist involved, or you're not trying assisted reproductive techniques, but nature is taking its own course, this LH that is released from the brain goes and hits the ovary, and a follicle that has matured is supposed to rupture as a result of the LH surge. When this is done in an ART technique like an IUI or an IVF, the gynecologist gives an injection, and this is usually an HCG injection that is given. It mimics the action of the LH hormone, and we hope that within 72 hours of giving the injection, the follicle will rupture and the egg will be released. Now, if this doesn't happen, usually the gynecologist will increase the dose of the rupturing medicine. So normal, doses used in India are around 5,000 or so IU. So the gynac should ideally be escalating it to a 10,000 IU and seeing if that will rupture the egg. Assuming that this has also been done, there are other rupturing medicines that are available. So the gynac may need to do that. But if repeatedly higher doses and different types of medicines haven't worked, there could be a problem with the maturation of the egg itself. So this will require, again, for the foundational health to be fixed so that the egg is of a better quality and the outer covering is thin enough to be ruptured. These are, again, not things which are readily available in medical books. This is from clinical experience. So, as you must be aware, the gynac generally prefers to use medicines, etc. They don't go to diet, nutrition, lifestyle. So this is certainly something for you to consider.
Yeah. Thank you, Mahesh. For those of you who have joined in just in recently, to tell you, we are running a Q&A session, and this is on PCOD and conception. Right now, we've reached the question answer session. So any question that you have, please put it in the chat box. If you want to make it very personal and private, you can message me directly. Otherwise, put it in the chat box and I will ask Mahesh the question and he will answer them. So moving on, there's a lady who says, I get a period only if I take a tablet. So I'm assuming it's a birth control pill. But does this mean that I am not ovulating?
Yes, if you are getting a period only upon taking a tablet, this is called a breakthrough bleed. This isn't a real period. And it's quite likely that you aren't ovulating. In fact, if you go to the Sepalika YouTube website, there is a playlist called PCOS. And in that, one of the key videos is from one of our consulting gynecologists, Dr. Pradnya Parulkar, very senior gynac practicing in Mumbai. She clearly explains how periods that come after taking a pill aren't real periods and they are not a real solution to PCOS or to anovulatory periods. Sharda, just one thing. So I think I've now got the chat window open and the lady is saying, I'm inducing ovulation from 5 months. Everything is fine. Egg is also rupturing, but I'm not conceiving. So the question is slightly different. So the answer to you, whoever this has asked this one is that there are cases where an egg may rupture and an egg is released from the ovary. However, if the fallopian tube is not open, then there is no place for the egg to meet the sperm and you may not conceive. That is reason number one. Reason number two could be that the quality of the sperm, even though sperm count, motility, morphology, all these are called gross parameters. Even if they are fine, if you have not done a DNA test of the gentleman's sperm, that could be a second reason why you're not conceiving. Normal looking sperm may have a lot of DNA damage that prevents conception. The third and the most difficult to solve, your own egg may look fine and it's rupturing fine, but it may have DNA defects due to which you may not conceive. Those are the three reasons. We can carry on.
All right. Okay. So this lady has a very high AMH of 6.5. So she's saying, first of all, is that really high and severe? Second is, she said, I have done lifestyle changes and my periods are normal. But how am I going to know if I'm ovulating and my egg is healthy?
Okay, so the answer to the ovulation question is what I just gave. I don't know if this lady joined a little late. Maybe once you check the recording, you can just go to the question previous to this. We have given 5 methods of telling how whether you're ovulating or not. As far as an AMH of 7 is concerned, yes, it is on the higher side, but don't be bothered by the AMH. The AMH is a chemical that is produced by immature cells. In fact, in some of our older patients, we tell them having a higher AMH means that you have a longer runway to try for a child because you have greater number of immature cells. The optimal range for a lady for AMH on day 3 is 2.2 to 4. Again, specifically on day 3. Many doctors in India wrongly measure AMH at different points of the period cycle and treat it as if AMH remains unchanged throughout the days of the period cycle. This is not true. Please do a day 2 or a day 3 test of AMH. If your periods are regular and you've made lifestyle changes, wonderful. You just have to be aware that women with PCOS do not often ovulate exactly in the middle of their period cycle. If you are a PCOS woman and you have a 45 or a 50-day cycle, reduce 2 weeks from the next expected day of your cycle, and that's around when you will ovulate and you should try intercourse.
That is such an important point. I just want to reiterate to everybody that just because you have PCOS, where the periods are not happening like the way a textbook says, between 28 to 30 or 35 days, does not mean that you're not ovulating. Mahesh's calculation is that 2 weeks before your next period date is usually the time that you could be ovulating. And therefore, like Google would say, between day 14 to day 16 may not necessarily apply to you if you're someone with irregular periods. Okay, so moving on, if someone has thyroid issues, does that mean they have PCOS?
No, the answer is a categorical no. However, thyroid and PCOS do seem linked to each other. And why is this associative link there? Remember, creation of a new life is a very energy intensive process, and the maturation of a follicle is also a very energy intensive process. Therefore, the ability of the body to generate energy is crucial for proper ovulation. If a woman has thyroid issues, her follicle may not mature properly, and that is the reason why thyroid issues are related to PCOS. And this is a little bit of a vicious cycle. Both thyroid and PCOS can often happen because of lifestyle. Correcting lifestyle can actually correct both of these things. So, you are right about the linkage, but it isn't one-on-one. So don't naturally assume that if you have hypothyroidism or you're on Eltroxin or Thyronome, that means you must have PCOD. No, you don't.
All right. The next question, and I'll answer this, is I am having severe hair fall issues. Is this a symptom of PCOD or PCOS? So yes, hair fall is a symptom of PCOS, but it is only one of the symptoms. PCOS actually has 30 symptoms. The most common ones that we are all aware of are things like irregular periods, like what Mahesh had earlier mentioned, high levels of male hormones, which could lead to cystic acne, insulin resistance, face and body hair. Hair fall is one of them. But to know if you really have PCOS or not, what I suggest is I have a lovely quiz that you can take on our website. Website is called sepalica.com. Just get into the PCOD section. There is a quiz which you answer and it will tell you whether you have PCOS or not. You don't really need to do a blood test to do it. You just need to answer those questions on your symptoms. Okay. Moving on, Mahesh, if someone...
Just to let everybody know, this particular quiz that has been designed by experts based on the American Androgen Excess Society guidelines. So it is a properly validated sort of quiz. Of course, remember, this is for polycystic ovarian syndrome, which means you may have some bunch of symptoms that put you in that syndrome category. This is not for disease. Go on.
Okay. All right. So this one is, if someone has PCOD in the fertile age group, will it affect menopause time? One point of 52 years, I'm presuming she's saying she's 52, still having irregular periods, most of the time scanty with clots, thinning of hair on the head, right side diagnosed with liver key stagnation and blood stasis.
Okay. So, assuming that the lady is 52 and that she had PCOD as a young person, and now she's, sort of still facing period irregularities. First up, at the age of 52, if you're still getting periods, well, congratulations to you. You are in the minority in India who, nowadays at around 40, 45, menopause begins to set in. That is, the starting point. Secondly, if you have irregular periods at 52, it's difficult to divide it into saying what parts are perimenopausal and what parts are still and go down to basics. What happens in a lady with PCOS? In a lady with PCOS, there is often poor ovulation during her reproductive phase. That means the hormone progesterone isn't secreted well enough. If the hormone progesterone is not secreted well enough, when the lady reaches menopause, both estrogen and progesterone begin to shut down because the ovaries begin to shut down. So at that time, you may indeed face more severe symptoms of perimenopause than somebody who did not have PCOD early on in their life. From your description of this liver key stagnation, etc., you're clearly somebody who's either using Chinese medicine or acupressure or acupuncture or one of those. So certainly for you to use your language, liver key stagnation based acupuncture or acupressure with magnets is a good idea for you to continue to use. Along with that, you can use the acupuncture points, which are specifically for empty heat rising, and that should also help. You can, tell your acupressure or acupuncture specialist to also look into, what is called a kidney yin deficiency. These are the two protocols that will help you at this age.
Thanks, Mahesh. The next one is, what are your recommendations for somebody with tiny sized anterior fibroid and PCOD with really bad period or menstrual pain?
Okay, so if the fibroid is anterior and it's small in size, unless it is very close to the mouth of the uterus or the fundus, then it is unlikely. And again, anterior fibroids are rarely like that. But that said, I haven't seen the MRI or the ultrasound, so I can't tell. But that apart, if you're facing very severe pains around your periods, the fibroid may not be the reason why this is happening. If you have had PCOD in the past, like I just said, women with PCOD have a low level of progesterone and they have what is called relative estrogen dominance. Estrogen is a hormone that can lead to lesions or strictures or endometriosis within the uterus or in the abdominal cavity, and that may explain the extreme pains that you have. You should get a proper evaluation from a gynecologist, and if they can't quite tell why your pains are happening, one of the most harmless supplements that one can use to see if it helps with period pains is magnesium. So don't use magnesium oxide, use magnesium glycinate. And if you get lots of brands on Amazon of magnesium glycinate, please try using that, and maybe the cramping and the pain will reduce with that. But do get a proper ovulation if you are in the fertile age bracket.
Okay. There's a lady who doesn't get a period for months. She's saying, how can I get period? I take tablets to get periods, northesterone tablet, which is a progestin one.
Yeah. So again, the periods that you get with pills are called breakthrough bleeds, and the only thing that they're good for is to prevent a cancer. So why does your gynec give you this pill? Because in a lady's normal physiology, if you get a period every month, then the inner wall of the uterus as well as a buildup of hormones in your body is removed via the period. In women who don't get periods regularly, this buildup can later lead to a precancerous stage. In order to avoid that, the gynec gives you the whether it's a norethisterone or a progestin of some other kind or an ethinyl estradiol pill, whatever these are. These all give you just a fake removal of that inner wall of the uterus. This is not a period. This does not lead to ovulation. Your next question is, how can I get regular periods? The question is, why are you not getting them in the first place? Why am I asking this question? You need a proper evaluation. Are you not getting a period because your brain is not telling your ovaries properly to produce eggs and to give you a period? This is called hypogonadism, but it is due to a hypothalamic problem. So the main seat of the problem is in the brain. If the brain is fine and the signals from the brain are going fine, FSH and LH are being secreted fine, but the ovaries are either small or non-responsive, then we have to help the ovaries to ovulate properly. If both of these are fine and yet you're not getting a period, is it a genetic problem, a birth defect of a small uterus or a septal uterus? What is the reason? So depending upon which of these three factors is the reason for you not getting periods, we have to address the fundamental issue, and only then will you get real periods. Till then, your doctor is doing the best they can, but these are not real periods.
Thanks, Mahesh. The next question is something that we have seen with a lot of our patients, which is a lady with PCOD and thyroid issues. So for the thyroid, she's taking euthyrox. For her PCOD, she's taking glucophage. She's overweight. She's had a few miscarriages. Her IUI failed, and now the doctor is recommending that she do IVF. By the way, she's also taken Dufaston for the period.
Wow.
She's 37. She's saying that, should I go for IVF as the gynac is recommending, or do you think natural pregnancy is possible?
Okay, so I'm actually going to answer this with a third option for you, right? So your question is, should I do IVF or should I do natural? My answer is, first fix the natural foundations, and then if you're unable to conceive, only then go for an IVF. Let me explain why I'm saying this. Like I said, if a lady has hypothyroidism, that could be alone a factor that leads to problems with conception. Then there is the PCOS or the diabetes, insulin resistance part to be dealt with. Both of these, unfortunately, in conventional gynecology, they are only able to help you with medicines. They are not able to help you truly address the root cause of the problem. And we have always known, not just in Ayurveda, but now allopathy has a new branch of medicine called functional medicine. These are doctors who go to the root cause of what is happening to you. They can use allopathic medicines, but they prefer to use nutrition as their first way of tackling your problems. If you're having issues with sugar management, you cannot produce good quality eggs, irrespective of what medicines you use to hide the blood sugar from being not flowing in your blood anymore. Instead, push it into the cells. That's what these medicines do. That may not be sufficient. If you fix your foundational health and your thyroid improves naturally and your blood sugar improves naturally, then your ovulation will also improve naturally. Now, why is it that your doctor is pushing you for an IVF? So let's just look at the common sense, right? You seem to have conceived either naturally or with an IUI. If you conceived naturally and you did not carry it forward because either you had a miscarriage before the heartbeat happened around 8 weeks or after that, then the question is, how will IVF fix this? The answer is, it can't. IVF cannot fix. All that IVF does is they can do a pre-implantation genetic testing of the embryo to make sure that is the embryo of a good quality and is it likely to proceed forward as a pregnancy rather than become a miscarriage. But this test is not conclusive. So in my books, any woman who conceives naturally and then goes on to have a miscarriage probably has a greater chance of having a baby once her foundations are fixed rather than trying for IVF directly. So I think this staged approach is what should be taken.
Got it. And that's a very important point of saying, and this is something that we tell everybody, that we're not against IVF. But our point of view is that IVF should always be the last resort because it requires a lot of investment from your side. I'm not just talking about monetary investment, the kind of side effects that you have. And as a woman, more so for the woman than for the husband, is a kind of emotional trauma that you have to go through. So keep that as your last resort. And our belief is every woman is meant to have children. And if she cannot, we need to get to the root cause. And very often doctors, rather than trying to get to the root cause, look at IVF as the straightforward solution. And we have found that when we get to the root cause, we're able to get the couple pregnant and there has been no need for an IVF. All right. So I'm going to move on. The next question is the lady who's got a period between 26 to 28 days. She's saying, is that normal? Hold on. I'll go to the second part of the question. She says, if I have PCOS and after 3 months of taking my medication, the period comes normal, what does it mean? And she also has acne on her cheeks.
Okay. So I don't know what the medication is, and I would request her to put the name in there because you can get regular periods even with a metformin, even with a, let's say, alpha reductase blocker, even with a hormonal pill. So we'll need to know what it means in order to give her a proper answer. And 26 to 28 days is very much a normal cycle. So any cycle that is above 24 days and up to even 40 to 45 days is considered quote unquote normal. But beyond that, since this particular webinar is focused on PCOS, We have had women who get periods regularly once every 55 or 60 days. And we have gotten them pregnant and have babies even with that cycle, without having to reverse that cycle. The only difference, again, to re-emphasize, is that women with PCOS who get regular but long gaps between periods ovulate later on in the period cycle. That's the only difference. So if you try for intercourse or conception, like internet tells you that you have a 60-day period, means middle of the period, 30 days is when you will ovulate. That is not how it happens. Ovulation will always happen only 14 to 16 days before the onset of a period, if any ovulation happens at all. So that's the time to really try. If you do that, then you can actually conceive with PCOS as well.
Okay. The next one is a super long question. Super long because there's a background and she's got 6 questions, but I'm going to summarize all of it. So she's 26 years old, irregular periods since puberty. Her ovaries were tested. They all look fine. She got married a year ago, but because they were eating out a lot, she put on weight. When she went to a doctor checked her and said she has PCOS and put her on pills. So she's got regular periods now. The pills have happened. We've got regular periods. But she says she's also somebody who stresses out a lot. Her mom had a history of thyroid, so she tested, it's negative. She says, my grandmother had the same issue, but that lady had a different lifestyle and she's got 2 kids 5 years apart. She said, I'm not planning to have children until a year from now, but I need to be healthy. So I'm desperate to be healthy. So here are her questions. Number 1, if a woman has insulin-resistant PCOS, what are the supplements you would advise? Okay. I think we'll go answer question by question because otherwise, we will get lost.
All right. Okay. So, I would not advise any supplements. So everybody is looking for a fix, and I'm not in favor of the quick fixes. I would simply say that you have to work on reducing the amount of processed carbs in your diet. And when you do that, automatically the insulin resistance is going to come down. Your doctor's already giving you pills. We have no desire to add more pills to that without working on the foundations. Next question.
Okay, the next question I will answer. What kind of exercise do I need to do if I have just 30 minutes a day? So I'm going to ask you for 35 minutes. So for 30 minutes every day, you will go for a walk, and a brisk walk. A brisk walk means you're going to take the heart rate up, which means it is at a stage where you find it difficult to speak to somebody. So 30 minutes of a brisk walk, and you give me 5 more minutes. And what are the 5 minutes for? Every night before going to bed, for 5 minutes, you're going to close your eyes, shut your mobile phone, first of all, an hour before bedtime. For 5 minutes before bedtime, you're going to close your eyes and just belly breathe, deep breathing for 5 minutes. That's all you need to address your stress. But the only thing here is consistency. So 30 minutes every day, even on a Sunday. So if we all can eat on a Sunday, we can all exercise and burn what we eat on a Sunday. So yes, so that's the second question. Third question, is sleep important? Absolutely. I sleep till about, you said that you are awake till about 11 p.m. Is it possible to reverse PCOS with that kind of a sleep schedule? Mahesh, you answer this one.
Sure. And yeah, 11 p.m. I mean, I would prefer that you went to bed at 10, but no problem with 11 p.m. as long as your dinner is the right kind. If you're eating a carb-loaded dinner and trying to go to bed at 11, then your blood will fluctuate during your sleeping hours and give you disturbed sleep. You wake up not feeling fresh, and therefore, it's spoiling. We have done a separate podcast on sleep and fertility. This is one of our good colleagues called Deepa Kannan. I'd like to give her a shout out. She's called the Sleep Whisperer, and it's an easy name to remember. So look up the Sleep Whisperer and look up the podcast we've done on the link between sleep and fertility. I just wish more people paid attention to this. I continue to hear me. I seem to have another internet fluctuation. Yeah. So please look up Sleep Whisperer Deepa Kannan podcast. We've given a lot of useful tips how sleep can support fertility.
Okay. So the next question is that in insulin resistance, and this is the same lady, can walking after a meal help? Absolutely. And you don't need to do 10 minutes. You need to do 100 steps. And this is for everybody on this webinar. Just 100 steps after each meal, breakfast, lunch, and dinner, within the house, around your dining table, your bedroom, your living room, whatever it is. But I cannot tell you how much it will improve your digestion and how well your insulin will also respond. Okay. The question is, another question is, do you recommend a vegetarian lifestyle for PCOS? You can do both. What is important is, see, here's what you need to remember. The human body does not recognize foods. It does not know whether you're eating a roti, whether you're eating chicken, whether you're eating pasta. All it recognizes are five things: carbohydrates, fats, proteins, vitamins, minerals. That's all. So whether you're eating a vegetarian meal or whether you're eating a non-vegetarian meal, that's up to you. But all you need to ensure that you have the right amount of protein. Most of us as Indians undereat on protein. Very important for PCOS. You need to eat good amount of healthy fats, even if if your weight is in excess, because fat burns fat. And you need to moderate your carbohydrates. I never say remove carbohydrates, because you should not. That's a food group that's important, but we really have to moderate or cut down on the carbohydrates. Your last question is spearmint tea important or helpful for androgen excess and insulin resistance? Mahesh.
Sure. Spearmint tea is indeed useful for androgen excess. It is a natural blocker of a particular highly active male hormone called dihydrotestosterone. So please have good quality spearmint tea thrice a day. There are no side effects or harms, and it might actually help you. Sharda, I know because you're also anchoring this, there's a lot of, you have to both look at the questions as well as handle the answers, etc. So I'm going to take a few questions that I can see we haven't answered as well. So Dolly, your question, which was at least 20 minutes ago, because we have got so much happening. How helpful is Panchakarma or Basti in infertility when you're trying to conceive? The answer is it can be very useful in hands of a qualified Ayurvedic doctor. Panchakarma is a highly involved process. It needs to be personalized per person. There are lots. Panchakarma basically means 5 kinds of ways of purging toxins from the body. You do it under supervision, and if your Ayurvedic doctor feels you need it, please do it. I'm having thyroid and also overweight. Does it cause difficulty in pregnancy? The answer is yes. Study after study shows that overweight can be one of the most important reasons women find it difficult to conceive. So please address your thyroid. Please address your weight. You find it easier to conceive. PCOD, regular periods, 20 to 30 days. We are trying last 1 year. Again, this is a normal occurrence. Since you have already been trying for 1 year, I don't know if you've been trying at the right time, whether you've used a follicular study to predict ovulation, and as a couple, you're trying to conceive and have intercourse at the right time. But if you've been trying for 1 whole year, it's time to get evaluated. It would be a good idea to either visit a gynec. Sepalika also does a preconception fertility consult. We've kept we do a very detailed analysis. We spend an hour with the couple who are serious to conceive, going through their history, their various lab reports, etc. You're welcome to do one of these, and we might be tell. Sperm motility not in the desired range will conceiving. Yes, it will, because motility is the #1 reason for failure of natural fertility. Remember this. Once an egg is released from an ovary, the fallopian tube has little finger-like projections. It picks up that egg and moves into the fallopian tube. Here, the egg waits for the sperm to swim through the vaginal passage, through the uterine passage, and into the fallopian tube. Only if the sperm can swim properly will it reach the egg in order to fertilize it. If there are motility issues, then that means that the sperm is not swimming properly. Fix your husband's foundations. We've seen motility improve hugely from 20% to 60%. You can have sperm motility increase with just good quality foundational health. Sorry, Shraddha, since I'm on a roll, I'll just finish a couple of more questions and hand it back to you.
No, carry on, Mahesh. You're doing well. You just
okay. All right. So Ankita, who's a nutrition therapy practitioner, wants to know what is the best transition from perimenopause to menopause? What are the herbs, supplements, diet, lifestyle changes? So the most important thing, for menopause is realizing that estrogen and progesterone are no longer being secreted by the ovary. The job of secreting small amounts of estrogen has been taken over by the adrenal glands. This happens as a natural transition in menopause. So women have to know that their adrenal glands need support. So things that support the adrenal glands, getting adequate amounts of sleep, doing pranayama, doing yoga, taking some adaptogenic herbs like ashwagandha that support the adrenal glands. These are all effective ways of transitioning into menopause with, without having too many symptoms. Which tests should be done to check for fallopian tube blockages? The specific test is called the HCG test, and this is called dye test actually. In let's use colloquial terms. So the dye is a test where the doctor will insert a certain liquid dye through the vaginal passage to see if the fallopian tubes are open and they can see the dye spilling out onto the ovaries. That is the only real test to check for fallopian tube blockages.
Mahesh, just hold on because you're on the
do not
fallopian tube. Mahesh, can you hold on? There was an earlier question that got missed where the lady has a fallopian tube filled with pus.
Yes.
Geez, is that harmful?
Yes, it is harmful. It is called a hydrosalpinx, and depending upon whether both tubes have plus or one has plus pus in it, your doctor may have advised clipping of the tube that has pus. So generally, if one tube has a hydrosalpinx, there is a high chance that the second one also has an infection which may not have developed pus yet. So unfortunately, this may be one of those rare cases where after trying for 2 or 3 IUI cycles, you may have to go for an IVF. No option but to do that. Any other questions you want to take, Sharda, or shall I just go through the chats?
Move on. You can go
All
ahead.
right. Okay. So no health issues, but get periods every 20 days, which means twice a month. Does it lead to cancer? No, it doesn't lead to cancer. You are 45 years old, you say. What it shows is that, so this is how it goes. When women get 2 periods within 40 days, it is because there is a high amount of a hormone called estrogen, and there isn't enough of a hormone called progesterone. Progesterone is secreted in the woman's body when she ovulates. So your 20-day periods are likely to be anovulatory. No egg is released. So it's important for you to get progesterone support. Not sure, lots of people, so I don't know if my colleague, my senior, Dr. Vivek Kadam, who practices bioidentical progesterone replacement, is on this call. I would suggest that you should look up Belle Sante Clinic. If you're based in India, it's a Bangalore-based clinic. Dr. Kadambi is an allopathic doctor, an MD who practices BHRT. He should be able to help you to avoid this frequent periods. And yes, while having frequent periods by itself doesn't increase cancer risk, high levels of estrogen that cause these frequent periods may increase estrogen risk. So please do consult an expert in BHRT.
Mahesh, I have a question because some of these are directly coming to me because of the confidentiality issue. So I just want to answer. This is the same lady who said that the moment she's put on birth control pills, the periods are regular. So I know you've listed the medicines, including Crimson. Here's what I would say. See, if it is a PCOD case, which is what it is, taking, as Mahesh mentioned, a birth control pill is only, you're going to get what is known as a false bleed, which means that when you stop that pill, your period most likely will stop and become irregular again. To address PCOS symptoms, to get your periods regular, to balance your hormones, you really need to get to the root cause. And that is what we would advise as a long-term solution that is safest from your health perspective. All right, more and more, Mahesh, you can move on to your questions.
All right, okay. Next question is from Sanover. If prolactin level is increased and I have PCOD, if I lower prolactin level, will I get cured? I am overweight, the lady says. Very valid question. So the hormone prolactin, as the name suggests, is pro-lactation. Its first job during a woman's reproductive life is to prevent a lady from having a second pregnancy when she is already breastfeeding one child. That is why prolactin prevents proper periods from happening. But there is a second way in which prolactin works. If you have overweight or if you are under a lot of mental stress, serum prolactin will go up to prevent you from getting ovulation, because the body feels this lady is under so much stress. This is not a good time for her to have a child. So the stress, like I mentioned, could be mental stress or it could be physical stress that is coming from overweight. So yeah, gynecologists do use medicine called cagoline in order to reduce serum prolactin levels and get back regular periods. But again, this is not the root cause treatment. By losing weight and by addressing high stressors in your life, serum prolactin can be brought down naturally. That will give you real ovulatory periods, and that will help you to truly fix, what's happening with you. All right.
So there's this lady who's 36 years old and she works night shift. She's been trying to
Okay.
get pregnant for almost a year. And when she missed her periods and did the pregnancy test, because she had pregnancy-like symptoms, the test came negative. She has regular periods. Can you suggest how she can conceive?
Yeah, so again, if you've been trying for one whole year and you've been trying at the right time, the way to do this is to get to the root cause of why you may not be conceiving. Is it a fallopian tube that is blocked? Is it an ovary that has a problem? You may get regular periods. Those periods may not involve release of an egg in the middle of the cycle. So, we need proper evaluation to be able to tell why you've been unable to conceive. But since you're specifically mentioning night shifts, it's clearly playing on your mind. And yes, in that same sleep episode, we covered how people who do night shifts have one of the highest rates of infertility across the world. So nurses who do night shifts, people who are on emergency duty like doctors, people who do BPO work, which is across time zones, the hormones of the body, melatonin, serotonin, these time-dependent hormones play an impact, have a role on your testosterone, on your estrogen, on your progesterone. And sometimes that can be the main factor to change. So I know it's not easy to change jobs. I know, these are all very difficult decisions. But before we even tell you that that is the reason, we need a proper evaluation. There's another question, which can we do yoga after ovulation while trying to conceive? The answer is absolutely yes. Many women think that somehow once they conceive, if they do poses which are, like, let's say, inverted dog or a mountain pose or any of these, somehow the liquid that's been formed will fall out or they'll have a miscarriage, etc. Nature does not make us fragile. Number one, an embryo that is formed during the first 8 weeks at least, its weight is so small that gravity has no effect on it. So it can't fall down. That's number one. Number two, there is a natural glue through which the embryo sits inside the uterus and not going to fall out. So as long as you don't jump on a trampoline, there isn't going to be anything that's going to happen. Yoga should be because of fibroids, uterus removal operation is suggested. How to avoid operation? So if you have not yet, again, I don't know your age. If your family is complete and you've been asked to remove your uterus because your fibroids are, very large, or you have heavy bleeds or painful bleeds, then the answer is different. If you're somebody who hasn't yet had a baby, no gynec in their right mind would ask for uterus removal. So I'm going to assume you're much older and your family is complete. You can put it in the comments box if it isn't the case. But generally, menopause is the only true cure for uterine fibroids. Other than that, we have not seen fibroids beyond a few millimeters in size get reduced by any medication. This involves acupuncture, homeopathy, Ayurveda, sympathy, nothing works. This is my clinical experience of 20 years. My own wife had fibroids. There was nothing that we could do till menopause came. And therefore, either one can wait till menopause or one can get the operation done. And if your doctor is suggesting uterus removal, it's likely that either there are multiple fibroids or the fibroids are very large. So unfortunately, I would say, depending upon how severe your clinical symptoms are, surgery may be the only option. Okay. Night shift, we can't get pregnant. 45, family is complete. Yes. So that's
Some of the herbs, the question is, what are some herbs or home remedies for increasing sperm motility?
Okay. So, the number one thing to do for sperm motility often is to fix somebody's diet. If you just look at, just Google insulin resistance sperm quality, just put this search term into the Google box, you will see so many studies where men who have pre-diabetes or have diabetes will often have poor quality sperm. So certainly, that is something to address. So make sure that you're getting enough fats, enough protein in your diet. That itself will improve motility. Beyond that, I would suggest zinc-rich foods. So pumpkin seeds, etc. And if you want to consider a zinc supplement, again, test for zinc and then, add a zinc supplement.
Also, do follow us on Instagram on Sepalika Fertility, because I have put out specific posts on improving sperm health. We put out, as I said, every week 4 posts at least on reproductive health, on conception, on egg quality, on sperm health, on ovarian health, connection between PCOD and conception, thyroid and pregnancy. So there is so much information. How do you look at blood test reports? Why does first trimester miscarriage happen? All of it. So I'd ask that, and they're all super, super informative. So do subscribe to our Instagram handle. It's called Sepalika Fertility. So here's a question, Mahesh. This lady stopped taking her contraceptive pills to regularize her periods. Since then, her periods are normal. She says, but I still have acne. Should I go and do an USG to check my ovaries?
Okay. So, it depends upon the quality of the acne. If it is cystic acne, then the answers are different. So let me explain why the acne is happening, why your birth control pills help, and what you can do instead. So certain women are born with genetics which make them more sensitive to high levels of male hormones. And there is a particular hormone called dihydrotestosterone, DHT, which if you have a sensitivity to, or you have high levels of DHT, it causes a pulling of oil under your skin. These are called sebum glands that fill up with oil. And then the acne vulgaris bacteria, which is naturally present on our skin, begins to eat that oil, and that is what causes acne. How does a birth control pill help to reduce this acne? Unfortunately, there is a saying in Hindi, and I will try and translate it into a few other languages, which is na rahega baans, na bajegi bansuri. So literally what the allopath does is takes away your hormones so that there is no longer natural hormones being produced. There is no testosterone, there is no estrogen, there is no dihydrotestosterone. Therefore, the acne responds. But is that a good thing? Of course not. If the flame, and this is an example we keep giving people, let's say the flame in the stove in your kitchen is very high, for some reason, the flame is really making all the food overcooked. Is the answer to chuck water on top of that flame? Absolutely not. The answer is to modulate that flame so that it is fit for cooking but doesn't burn the food. So the way to handle this kind of acne that keeps coming in women who have sensitivity to male hormones is to reduce the lifestyle things that trigger this sort of a high male hormone. So again, it's very rare for women to not have insulin resistance and yet have this acne. So if you can regulate your lifestyle, reduce your stress, reduce your intake of processed carbs, reduce the amount of junk that you take, as well as a very important natural hack that we use called seed cycling. This is a favorite of Sharda's, and we tell it to everybody. We have a PDF that is free. We'll share it with anybody who writes in. It's basically using 2 seeds in the first half of a period cycle, using 2 seeds in the second half of the period cycle. Remember the acronym FLAP, FLAP, for the first half. So 1 tablespoon of flax seeds, 1 tablespoon of pumpkin seeds, level, soak them in water overnight. Next day, throw away the water, eat up the soaked seeds first thing in the morning. This is called FLAP, FLAP. This helps your estrogen to be healthy. It removes excess estrogen where it's not needed, as a result of which this kind of a hormonal imbalance is reduced. In the second half of your cycle, remember the acronym SUSE, SUSE, sunflower seeds and sesame seeds. 1 tablespoon, again, level tablespoon, soak it in water, throw away water, chew up the seeds, eat them. This will help to support progesterone in the second half of the cycle, removes excess estrogen, removes excess hormones. Therefore, you don't have a hormone buildup in your skin. Acne will respond. So this is one good way. And another interesting way is what a lady asked earlier. Can spearmint tea help? Yes, spearmint tea can help this particular lady as well, who's taking birth control pills. And now once she's left them, the acne is coming back.
All right. Can Ritucharya help in conception, fertility, and women's health?
Absolutely. And for those who don't know what Ritucharya is basically a set of practices that are recommended in Ayurveda as being smart or healthy practices to follow during a period cycle. So for example, one of the things that Ritucharya says is that you should not visit a temple during your periods. And the whole country goes up in arms because, all this is about saying, oh my God, women's equality, this is Manuvada, this is trying to keep women out of temples and so on. And yet Ritucharya says, don't do it for a very scientific reason. Women are the only, of the genders, obviously women are the ones who have a period. A period is a time when there is a particular Ayurvedic Vayu called Apanavayu, downward moving wind that causes a period flow to happen. As you know, period flow is meant to go downwards, not go upwards. So if your period flow is going downwards and you go to a temple where your energies are meant to be raised, your energies are meant to go upwards, it may stop the downward flow of that menstrual blood. It may pull it upwards and literally cause conditions like endometriosis or hormonal imbalances. So these are the practices that Ritucharya recommends. The ones that are easier for us to swallow are things like eat lighter food. Your body is already trying to remove toxins. At a time like that, don't give it heavy or junk food. Eat very light food. Eat khichdi on your blood flow days, at least as part of one meal, and you will find that, your whole period cycle, reproductive health, everything improves. So Ritucharya is very science-based. It's very sad that we've lost all the wisdom behind it and we think it's all superstition. So yeah, please follow.
I'm married for 8 years. I've taken after marriage birth control pills like Mala D for about 6 to 8 months. I'm trying to conceive now for 4 years. Is this the reason, the fact that I took birth control pills, the reason for me not getting pregnant?
No, I would, as much as I dislike birth control pills for all the side effects that they give, 6 to 8 months of usage is not sufficient for somebody to face fertility issues for 4 years. That is not scientifically correct. You may have had some other underlying issues that did get exacerbated or became worse with the birth control pill use. That is possible. So we'll have to, excuse me, do a thorough evaluation to understand why this may be the case.
Yeah, okay. There's a lady, obviously, she came in a little later. She's got PCOS and thyroid issues. Will that be an issue to get pregnant?
Yes, PCOS and thyroid can indeed affect. I mean, it's unfair to say every woman with PCOS and thyroid will have trouble conceiving, but certainly it is wise to address these foundational issues before trying to get pregnant. So this is what I tell people, people plan so much for building a house, right? So whether you're buying a flat in a city like Mumbai or you're building with land in one of those places where India land is still affordable, so much effort we put into it. We look for the right piece of land. Is it legal? What is the title holding? Will there be sun? Will there be what? How will the access road be? Who's the architect? We will do 100 checks and balances before buying a home. A child is for life. You're bringing in another human being. And yet people want to ask, should I do foundational work before bringing in a child? I mean, ask yourself the common sense question. If you and your spouse are in fantastic health, does it not stand common sense reason that you will produce the best baby possible? Then why do we even think if should we be doing something about our core health or not? Should we optimize D3? Should we optimize thyroid? Why do we need vitamins and minerals before trying to conceive? I mean, so our thing is, please treat your child or your child to be like you would treat a lifetime investment in a real estate. Just do the foundational work, do all your checks and balances, and your child will thank you for life and you'll have a fantastic offspring. So, sorry, bit of a rant, but yeah, go on.
It's past your talking time, Mahesh. So I will give you the last question, which is that lady says she's got fibroids. It's even after menopause. So is there any solution?
No, so if the fibroids after menopause are giving you any physical symptoms, then it makes sense to address them. Otherwise, what do I mean that fibroids will resolve after menopause? All I mean is that a fibroid which is denied of blood flow on a monthly basis begins to gradually shrink. It does not mean that it will disappear or that it will go away completely at the next ultrasound. ignore that fibroid if it is not giving you any symptoms or discomfort. Of course, if your gynac feels we must do a biopsy, check that the fibroid doesn't turn cancerous, that is certainly something to do. But yes, fibroids can continue after menopause, but without giving any troubles.
Super, great. Thank you so much. I think we've come to the end of our session. Thank you, everybody, for attending this session on a Sunday morning. If you have any further questions, do message us or WhatsApp us on 9867337112. I promise we will personally answer all your questions. And if you want to get more tips, we keep, as I said, sending it out on our Instagram handle, Sepalika Fertility. Have a wonderful day.
Thank you. Bye-bye.
Bye-bye.